Welcome to Public Health Brief, where we bring you trusted health information you can use to protect yourself and your loved ones. Today's video is about something that can happen suddenly and without warning: snake bites. Every year, snake bites cause thousands of deaths and disabilities worldwide, but the truth is that many of these tragedies are preventable with the right first aid knowledge. In this video, First Aid for Snake Bites, Life-Saving Steps in Minutes, you'll learn exactly what to do in those critical moments after a bite. These steps are simple, science-based, and could mean the difference between survival and tragedy. So, stay tuned and don't forget to hit subscribe so you never miss our life-saving health guides. Snake bites are frightening, sudden, and potentially deadly, but knowing the right steps to take in those first few minutes can mean the difference between life and death. Around the world, millions of people are bitten by snakes every year. And while not all snakes are venomous, the danger of panic and improper first aid makes the situation worse. In this video, we're going to talk about what really happens during a snake bite, what you should and shouldn't do, and how immediate first aid can keep someone alive until professional medical care arrives. When a snake strikes, it often happens unexpectedly. You may be walking through tall grass, working in a field, gathering firewood, or even resting near a rural home, when suddenly there's a sharp, burning pain. In those first seconds, fear often takes over. The victim's heart races, adrenaline pumps, and everyone around panics. This is the critical moment because the first response shapes the outcome. Panic increases heart rate and blood circulation, which can spread venom more quickly through the body. That's why the very first step, before anything else, is to stay calm and help the victim remain as still as possible. Calmness is not just emotional, it is medical. A steady body slows down venom movement. Understanding what venom does inside the body helps explain why first aid is so important. Snake venom can affect the body in several ways. Some venoms attack the nervous system, leading to paralysis, others destroy blood cells and tissues, causing massive internal damage, and some lead to severe bleeding and organ failure. These effects are not instant, they take time to spread. That's the window of opportunity for first aid. Acting fast and correctly buys the victim those precious minutes or hours until antivenom treatment can be given in a hospital. So what should happen after a snake bite? The priority is to keep the victim as still as possible. Movement spreads venom, so carrying the person, rather than letting them walk, is ideal. If carrying is impossible, they should walk slowly, with support, minimizing steps. At the same time, keep the affected limb immobilized. Imagine a bite on the leg. The best response is to lay the person down, keep the leg straight, and bandage or splint it to reduce movement. The less the limb moves, the slower the venom spreads. Pressure immobilization is one of the most effective first aid techniques. This involves wrapping the limb firmly, starting from the bite side and working upward, similar to wrapping a sprain. The goal is not to cut off blood completely but to apply even pressure that restricts lymphatic flow, which is how venom often spreads. After the bandage, a splint can be applied to keep the limb from bending. This simple technique, if done correctly, has saved countless lives, especially in remote areas where medical help may be hours away. While immobilization helps, some traditional practices are harmful and can make things worse. Cutting the wound, sucking out venom, applying ice, or using tight tourniquets are all dangerous myths. They do not stop venom and often increase tissue damage or cause infections. For example, sucking venom from a wound introduces bacteria and does almost nothing to remove poison. Cutting the bite increases bleeding and spreads venom faster. Tourniquets can stop blood flow completely, leading to limb loss, without preventing venom from entering the body. Ice worsens tissue injury and delays proper treatment. These outdated methods may seem logical, but science has shown they are more harmful than helpful. What truly matters is time and calmness. Getting the victim to a medical facility quickly is the ultimate goal, but since antivenom is not always available nearby, first aid is the bridge that keeps them stable. If possible, remember details about the snake's appearance. You don't need to catch or kill it, which is dangerous, but if you can safely note its color, size, or markings, that information can help doctors choose the right treatment. In many regions, snake species determine the type of antivenom needed, so those details matter. Another key factor is hydration and monitoring. The victim should avoid food, alcohol, or stimulants, which can speed up circulation. Offer reassurance constantly, because fear alone can push the body into shock. Watch their breathing, pulse, and consciousness. If the person loses consciousness or struggles to breathe, basic life support, keeping the airway open and providing rescue breaths if trained may be necessary while waiting for medical help. Snake bite survival is not just about the bite, it's about the whole environment. In rural communities, where snakes are common and hospitals are far away, knowledge of first aid becomes life-saving public health education. Teaching families, farmers, and children how to respond ensures that when an accident happens, the reaction is organized, not panicked. Communities that practice immobilization and quick transport see far fewer deaths than those relying on harmful traditional methods. Even in urban settings, accidents happen. Exotic pets, hiking trips, or rural travel can expose anyone to risk. That's why understanding the right steps is not just for those living in snake-prone areas. Just as we learn CPR for emergencies, snake bite first aid is another universal skill that everyone benefits from knowing. Now, let's imagine a real-life scenario. A farmer in a village is bitten while harvesting crops. Immediately, neighbors rush in. Instead of tying a rope tightly around his leg and cutting the wound, they remember proper first aid. They lay him down in the shade, reassure him, and keep him still. They apply a firm bandage from the bite upward, then splint the leg with a stick to keep it straight. Two men carry him on a makeshift stretcher to the nearest road, where transport can reach them. The victim remains calm, the venom spreads slowly, and by the time they reach the hospital, he is weak but alive, and anti-venom saves him fully. This is the power of correct first aid. Every snake bite is a race against time, but the winner is not always venom. The winner can be knowledge, calmness, and quick action. By remembering these life-saving steps, you can protect yourself, your family, or even a stranger in need. It's about staying calm, immobilizing, avoiding harmful myths, and reaching medical care as fast as possible. Snake bites may seem rare, but for many communities they are a daily reality. Learning first aid is not just personal safety, it is a responsibility to others. The next time you walk in tall grass, hike in the forest, or see someone working barefoot in the field, remember that danger can strike in an instant. But with the right knowledge, so can the response. And that response, those first few minutes, are the difference between tragedy and survival. So, if you've watched this far, you now know the truth. Snake bite first aid is simple, but powerful. Keep calm, keep still, immobilize, and get help. Share this knowledge with others, because one day, you might be the person who saves a life. So our conclusion is snake bites can be terrifying, but they don't have to be fatal if you know how to respond. Remember, stay calm, keep the victim still, immobilize the bitten limb, and get medical help as quickly as possible. Avoid harmful myths and focus on proven first aid. These few minutes of action can save a life. If you found this video helpful, please like, share, and subscribe to Public Health Brief, because knowledge shared is a life saved. Drop a comment below if you have questions, or if you want us to cover other health emergencies. Together, we can build stronger, healthier communities.